greetings to all the participants who have joined in. On the behalf of the National Patient Safety Secretariat, we organized this fortnight webinar series. And today, I think we have the seventh or the eighth webinar. And this is an attempt to do capacity building among the various medical colleges in the country, most of them who have been newly formed as well, to sensitize on the various issues of patient safety, so as to have high rates of patient satisfaction and quality of care. So today we have the webinar on the role of the biomedical waste management in patient safety, and we have our expert from AIMS Bilaspur. So before I just to indicate you the relationship between biomedical waste management and patient safety, uh, efficient BMW practices are required for and very crucial for patient safety, because it helps us to prevent hospital acquired infection, because it should not happen that patient has come to the hospital for one disease and is acquiring another one because of poor practices in the hospital, or the environment where they are in the hospital setting. And of course, environmental hazard is also there. So the overall healthcare quality, if we have good BMW practices, the overall healthcare quality improves. Hence, proper training, adherence to the protocols, and sustainable disposal practices are some of the points which needs to be taken care of. With these few words, I would like to request Dr. L. Swasticharan sir, additional DDG, Director EMR, and the head of the National Patient Safety Secretariat at the Directorate General of Health Services, Ministry of Health and Family Welfare, for the welcome address before we invite the esteemed speaker. Sir, I would like to request you to please take over.
Thank you, Avinash. Can you confirm whether you can hear me?
Sir, you are audible, sir.
Okay, thank you very much. And greetings from the National Patient Safety Secretariat to all patient safety nodal officers from all AIMS, JIPMER, PGI, the state medical colleges, hospitals, whoever, residents or nurses or all healthcare professionals who have joined here once again in this fortnightly webinar from the Patient Safety Secretariat. As we continue our national webinar series on patient safety, we have been working on the 6 important pillars which have been identified under the National Patient Safety Implementation Framework. Today is very important, as Dr. Avinash has rightly said. We will be dwelling on biomedical waste management, which is a crucial, critical aspect of infection prevention and hospital safety. Friends, we all know that we are here to build a culture for patient safety across India, across all health fraternity that are working as teams in various health facilities. And this very important topic is relevant to all of us. We do generate some of the waste ourselves, and we do have to take care of the waste so that it doesn't harm the patients who have come to the healthcare facility expecting that no harm happens to them. So this is very important. And we also are aware of the fact that India, as a country, generates approximately about 775 tons of biomedical waste on a daily basis, and improper waste, you can imagine, handling is linked to about 10 to 15% of what is known as hospital-acquired infections. So we have a very eminent expert here today, Dr. Sriram. Welcome to this webinar series, and we thank you for joining us, showing your interest and trying to create the culture, shape up the teams that we have in India. And I'm sure Dr. Sriram will be speaking on various topics, ranging from several strategies like the compliance with the BMW rules, what are the infection control areas that we need to ensure in the hospital, the capacity building, training and awareness activities, and also how to make all this sustainable, that it continues as a culture, not as a point that we discussed today, not as something we do on 1 day or 2 day basis, but rather a kind of way of life for all of us working in healthcare settings. So with this, I would like to Thank once again, Dr. Sriram, and please take us through. And I hope many of us who are listening to you from India, from across the states, would be benefited by the rich experience that you would be sharing today. Thank you very much.
Thank you, sir. Thank you. So, start. Good afternoon. Good afternoon. Good afternoon to all. So, am I audible?
Yes, sir, you are audible.
So, should I be sharing the slides?
Avdesh, sir?
Yes, sir. Please go ahead.
Okay.
Yes, please put it on slideshow mode.
Okay, good afternoon to all. Good afternoon to the Patient Safety Secretariat, and good afternoon to all the participants from our various medical colleges. As a patient safety is probably as probably quality of an hospital care facility, patient safety has become extremely important. And among the topics which we have been discussing on regular basis, today is the role of biomedical waste management in patient safety. Probably I have to say that biomedical waste management is absolutely essential for any hospital care setting. If we look at the infection and prevention control in a hospital setting, then whatever the waste we are generating in the biomedical waste, it's an important aspect in infection control and a mandatory requirement for patient safety. The reality is because of lack of proper way of biomedical waste management, it has become a major public health problem. If you look at the UNICEF and WHO data, 2023 will say that proper biomedical waste management is happening only 25 to 30% of the hospitals across. If you look at 1.5 to 2 kg of hazardous biomedical waste per bed per hospital per day, we are producing that much of biomedical waste, and it is almost become a stringent rules and regulations have to come into place to make it kind of an important measure. There are 16 billion injections annually worldwide happening, and the improper method of incineration results in emission of unsafe gases, which is an environmental and climate hazard in itself. We'll define biomedical waste management, any waste generated during diagnosis, treatment, or immunization of human beings or animals or in research activities, but in the production of testing or biological or health camps. So that is the definition of biomedical waste. It was initially biomedical waste rules had come into place in 1998, which was further modified in 2016. And we had a couple of amendments in 2018 and 2019 by Ministry of Environment and Forest and Climate Change. The basic objective of biomedical waste is rules and regulations is reduce the amount of biomedical waste, as far as possible reuse and recycle the biomedical waste, and make it an effective parameter to assess the healthcare facilities throughout the country. So what is the need for a biomedical waste management? If you look at this picture, it's everywhere in the entire picture, it is scattered with disposable needles, syringes, then you have untreated hospital water and liquid waste. Then we have source of infection, source of pollution, and scavenging by rat pickers and animals. So this is not a very ideal situation where sanitation is the most important parameter in infection control, and the source of biomedical waste should not be the source of further infections. Health hazards. It can happen sharps, which we inflicted injuries, toxic exposure to cytotoxic drugs, exposure to mercury and dioxins, which are hazardous gases, recirculation of the waste, chemical burns, air, water, and land pollution, thermal injuries, radiation burns, and carcinogens, and antimicrobial resistance through unsafe storage, disposal, unsafe disposal, pharmaceutical waste, which are again reused. environment and climate impact of this hazardous biomedical waste. Now, health hazards can be kind of in terms of infections like HIV, hepatitis B, HCV, cholera, salmonella, Shigella, rabies, anthrax, tuberculosis, pneumonia. Sharps can also cause infections. Cytotoxic radioactive waste can cause cancer, genetic mutation, birth defects, chemical waste poisoning, dermatitis, conjunctivitis, bronchitis. Now, healthcare waste, probably we look at the healthcare waste. 85% of the healthcare waste is general waste. And among the 15% is biomedical waste. If you look at the biomedical waste of 15%, only 10% is infective waste. So if we kind of look at the hospital waste, it can be categorized as biomedical waste, general waste, and other waste. Biomedical waste is again having a kind of an contaminated non-plastic waste, contaminated plastic waste, waste sharps, which includes metals, and others are metallic body implants and glassware. Look at general waste, again broadly classified as wet waste and dry waste, and there's other parameter of construction and demolition waste. Other waste which comes under hazardous waste are batteries, e-waste, and radioactive waste. So biomedical waste management rules schedules according to 4 schedules. Schedule 1 is categorization and management of the biomedical waste. Schedule 2 standards of treatment and disposal of the biomedical waste. Prescribed authorities and corresponding duties. Schedule 4 is label of containers or bags and label for transportation of biomedical waste, bags or containers. Now, what is steps of biomedical waste management? First step is waste segregation at source of generation, not after at the storage place or collected centers. It has to be segregation at the source of generation. That is extremely important. Step 2 is pre-treat lab and highly infectious waste, especially the non-plastic waste, which have to be pre-treated. And step 3 is collection and storage of segregated waste in color-coded bags, containers, and bins, which should be bar-coded. Step 4 is intramural transportation of the from generation site to the central storage area. Step 5 is storage of the waste. Then step 6 is treatment, should be within 48 hours of generation. And step 7 is disposal. We look at all of them. Now, classification and color coding is the most important aspect of biomedical waste management, which should be aggregated at source by the generators. 4 categories based on the segregation pathway and color code, labeled and barcoded. This is extremely important. That is the reason why healthcare workers need to be regularly trained regarding this kind of color coding and classification. First is yellow bag, which consists of infectious non-plastic waste. Then is red bag for infectious plastic waste. Then white translucent sharp container puncture-proof bags for sharps. Then blue container puncture-proof for broken glass items and implants. Now we look at first is yellow bags, which has types of waste as human anatomical waste, animal anatomical waste, soil waste, expired medicines, chemical waste, chemical liquid waste, discarded linen, mattress, bedding, body fluids, microbiology, then microbiology, biotechnology, other clinical lab waste. Red is contaminated waste, which is recyclable like gloves, syringes, bottles, IV tubings. White is white sharps. Blue is glassware like vials and ampoules, and metallic body implants. Now, all the waste bags which are collected should have this kind of symbol of either it's a kind of symbol of biohazard or cytotoxic, should be separately packed, and it should always be accompanied with a barcode. And all the places where the biomedical waste is stored or kind of treated should have in this signal of authorized personnel only, where it should be a kind of lock and key, where only those personnel who are handlers who are dealing with biomedical waste should be allowed to be part of it. Now, collection, segregated waste collected from all over the hospital by kind of waste trolleys. The frequency of waste collection is emergencies 3 times per day, OPDs and labs 2 times per day, wards once or twice per day, depending on the waste generation. Administrative areas, office and supervisor once a day. Storage area is cleaned daily. That is an important aspect. Storage area should not be a source of infection for the personnel who are handling the biomedical waste. Now, packaging is always packaging should be done in such a way that only 2/3 of the kind of pack is filled up. It should not be overbrimmed so that it should not overflow. The important essential parts is one should mention the date of generation, type of waste category, waste quantity in kg, name and address of the hospital, contact person name and phone number, contact details in case of any emergency, receiver contact details, name, address, and contact details. In packaging, it's extremely important that biomedical waste should not be mixed with general waste. If biochemical waste is mixed with general waste, then entire waste becomes a hazardous biomedical waste only. Now, transportation. Transportation to the collection site in color-coded dedicated waste trolleys, which means that these waste trolleys should specifically used for biomedical waste only, not for any other purpose. Trolleys are cleaned and disinfected daily. The handlers and workers should use the PPEs with like boots, heavy-duty gloves, masks, and aprons. The waste is not stored for more than 48 hours at collection site. Avoid heavy traffic in high-risk areas. That common biomedical waste treatment facility should be away from the public access areas. Now we look at a kind of if one is yellow container, yellow bags, non-chlorinated plastic bags are used, which includes, I repeat, for kind purpose of kind of reminder, human anatomical waste, animal anatomical waste, soil waste, expired medicines, chemical waste, microbiotechnology, other clinical chemical liquid waste. The treatment option is incineration of more than 1200 degrees centigrade, plasma pyrolysis is again which heat generation, or deep burial. Then a kind of an contaminated kind of waste, plastic like tubes, bottles, IV tubes, sets, catheters, urinary bags, syringes, autoclaving or hydroclaving, and then recycling. So white translucent sharps include wash sharps include metal, auto sterilization, autoclaving or deep sterilization followed by mutilation. Blue is glassware, disinfection and microwaving, and then sent for recycling. So if you look at kind of what needs to be taken with action taken by healthcare personnel, probably those who are dealing with human anatomical waste should be handled handed over to the common biomedical waste center. And those who are the waste which is having a fetus should be covered in yellow bag separately. And there should be a copy of medical termination pregnancy certificate either issued with obstetricians or medical superintendent, SMO, or from the healthcare center. If there is not having any agreement with the common biomedical treatment center, dispose in deep burial thing, but the same rule applies for in case of medical kind of termination of pregnancy fetuses where certificate should be issued by the obstetrician or the medical superintendent or the SMO or CMO. Now, soil waste, the waste is handled, disposed of the common biomedical waste center. It can be, in cases where it is no agreement with biomedical treatment center, it will be deep burial. Now, expired discarded medicines, all expired and discarded medicines, including cytotoxic drugs, expires are either returned back to the manufacturer or hand over to the common biomedical treatment facility to dispose through incineration. Now, chemical liquid waste, liquid generation due to chemicals. The chemical liquid waste must be collected through a separate system leading to effluent treatment plant and should be kind of disinfected, pre-treatment disinfected with 1% hypochlorite solution with a minimum contact time of 30 minutes. Exception is that silver X-ray developing film must be given to authorized recyclers for resource thing. But in which facility where this biomedical treatment center is not available, minimum thing can be done is kind of a pre-treatment with chemical disinfectants before it is converted into general waste. Discarded linens, mattresses, beddings contaminated should be handed over to biomedical treatment center, or they should be kind of an deep burial through kind of an after disinfection. Microbiology should be pre-treated with autoclaved, should be kind of pre-treatment is given and handed to the biomedical treatment center. And contaminated red kind of a bag has to be over to common biomedical treatment center. So Then sharps should be handed out to common biomedical treatment center. They should, if it is no facilities available, then sharp pits can be used after shredding or mutilating the sharps. So the glassware and metal what should be handed over the biomedical treatment after treatment, pre-treatment with 1% hypochlorite solution. Again, this one can be put in sharps. When kinds of biomedical management, we are three kind of an operative definitions. What is called occupier, operator, and prescribed authorities. Occupier is the institutes like hospitals, medical colleges, nursing homes, and different medical healthcare facility establishments. Operator is the facility operators of common biomedical treatment facility responsible for the collection, reception, storage, transport, treatment, disposal, any form of biomedical handling. Prescribed authorities to start with Minister of Environmental, Forest and Climate, then central and state pollution control boards, state governments, and then municipal corporations. Other things are prescribed authorities who provide the authorization to kind of use follow the biomedical based rules for the different institutes. Now the occupier is the institute. Institute occupier kind of facilitates a team of who will function and work together to manage and implement the biomedical regulations, which includes medical superintendent, additional medical superintendent, officer in charge biomedical waste management, quality manager, department nodal officers, nursing officers, technical officers, all healthcare workers, sanitary supervisors, and sanitary workers. What are the roles and responsibilities of healthcare facility? First is implementation of biomedical waste rules and regulations. And for that, it is important to understand what are the guidelines of the rules and regulations. And legal compliance regarding the implementation of the rules is the responsibility of the institutes. And another is submission of accident and annual reports to the Central Pollution Control Board or Committee or State Pollution Control Board or committees. Now, this accident reporting should happen within 24 hours after an accident. It can be minor or major. And there should be annual reports, and there should always be kind of registration, maintenance of register for the biomedical waste, which is being done on daily basis, maintaining of register, and registers have to be kind of maintained for a period of 5 years. Ensuring occupation of all safety of the employees who are involved in biomedical waste management in terms of giving them vaccinations, like say hepatitis vaccinations, and also doing a regular health checkup annually. Health checkups would include detailed medical checkup for them, including all the systems and all functions, and their whatever ailments or things should be taken care by the institute. Then monitoring and reviewing the activities related to biomedical waste handling, which includes starting from segregation to storage to transport to coordinating with that common biomedical waste treatment facility. And training of healthcare workers, training of healthcare is mandatory. In the sense, at least kind of a regular training is required in various aspects of biomedical waste management. So these are initial roles and responsibility of the biomedical waste management group. There is something called biomedical waste committee should be formed in each institute. And it is important that the quality cell of the medical colleges every medical college should have a quality cell, and in which in biomedical waste committee is a mandatory thing. They should meet at least twice a year, say every 6 months. They should survey and evaluate the biomedical waste in the hospital from the segregation point till the end point of disposal. Identify locations of placement of the bins and equipments, and always kind of relook at these parameters and what can be done to make it better. Then implementation of biomedical waste rules, regular updates needs to be provided regarding biomedical waste rules and in the form of training of the staff. Then procurement of the biomedical waste, what other things are required? They should be and it should be done kind of with kind of no compromise source and a source reduction. How we will source reduction, because objective should be reduce, reuse, and recycle. Registry and record keeping is an important aspect of biomedical waste, and regular checks and balances in this record keeping. Operator-wise, staff and retrievers should be provided with PPE, gloves, masks, and boots. PPE, gloves, these things have to be provided round the clock, not just exceptional cases or during a COVID period or something like that. Retrievers must be provided with bright yellow rubber gloves. Staff in the incinerator chamber must be provided with non-inflammable kit. Kit consists of gas mask, boots, and eye cover. Establish a barcode system for bags or containers containing biomedical waste for disposal. Operator to ensure timely collection and transport to the common biomedical treatment center. So, common biomedical waste treatment facility. No hospital, healthcare, or facility should establish on-site biomedical treatment facility if the service of common biomedical treatment facilities available within 75 kilometers distance. Within 75 kilometers, if it is available, it should be utilized. If it is beyond 75 kilometers, probably healthcare facility take the permissions and approvals to start one. Now, Central Pollution Control Board and State Pollution can have the authority to cancel the authorization of non-compliant hospitals and common biomedical treatment facility found violating the biomedical waste management rules 2016. Now, accident reporting. Accident can be major, can be minor. Major, like toppling of a truck carrying biomedical waste, accidental release of biomedical waste in water bodies, fire hazard and blast, flood or erosion of deep burial pit. Minor, like needle stick injuries, splash exposure, mercury spills, and chemical spillage. This is a diagram of where personal protective equipment. One should use heavy duty gloves like workman gloves, gum boots, head cap, face mask, splash proofs, aprons, and then safety shoes. This is the waste collection example of waste collection cart and transport of the waste collection cart based on the type of category. There's a different kind of waste which are seeing the yellow waste, red waste, blue waste, white waste, then cutting needle tip, destroying syringes and nozzle. There's a different packaging is an important aspect. What initially we saw that when we pack thing, it should be only kind of 2/3 of packed and it should be tightly sealed. And there should not be any stapling of the packets, which can result in tears. It should be very important that sharps should not be in polythene bags. Another thing is that the chlorinated plastic bags are no more completely obsolete, should not be used at all, which has been stopped using since 2019. So as you see, one should seal, twist, and tape the bags and properly seal it. There should not be any spillage and overflowing during transport. These are certain from the cytotoxic drug vials and HCV, they should be separately packed. This is transport of yellow waste, transport of red waste. This is shredder where kind of sharps are kind of shredded and made into minute things. Then here it's important to weigh the biocon waste packets and then barcoding should be done. This is different kinds of trolleys which are used and packages in kind of biocon waste management. This is a flow chart of a sewage treatment plant, which includes kind of an liquid waste derived from the hospitals. There is a preliminary treatment, primary treatment, secondary treatment, and tertiary treatment, and try and to kind of separate the sludge from the liquid waste. So this is a pit for sharps, kind of a steel pipe is there. Then one thing is important is that there should be at least 6 meter distance between the water table and the pit for sharps. That is important. So, and this is a kind of a scheme for how waste water is collected. First, chemical liquid waste and hospital waste, they should be kind of separately done. And kind of an then we have a kind of equalization tank, primary clarifier, secondary clarifier, then final discharge. Deep burial pit, which is used for kind of an non-plastic contaminated waste, and we kind of the depth of around 2 to 5 meters. It should be covered with a kind of deep burial pit with the waste, then around 50 centimeter lime, and then then soil is put over it. So this is an example of deep burial pit. So this is a picture showing incineration at a treatment facility and deep burial where this treatment facility, common biological treatment facility, does not exist. This is an example of sharp pit where kind of a steel kind of thing is done, and sharps are after kind of mutilation, studded, they are disposed of. This is a liquid waste management picture showing kind of a ETP kind of thing, especially with kind of a chemical waste. This is a sewage treatment facility where kind of before kind of an mixed with the general kind of sewage waste, it should be kind of chlorinated and treated, chemically disinfected before disposal. This is again kind of for liquid waste. Thank you.
Sir, thank you so much for touching all the areas on biomedical waste in a minute detail. I think one or two questions from the chat we can take already. We have it's 1 minute past that schedule. Sir, one of the questions is it necessary to pack separately for blood-borne infections like hepatitis B, HIV, Hep C waste?
Absolutely.
Yes.
Absolutely. It's an absolute requirement. That is the reason why kind of at the generation itself, it should be kind of an clear cut. It should be packed. One of the pictures showing the HCV is separated, septotoxic drugs are separated. It should be mixed together. When we look at the biomedical hospital waste, 85% is general waste, 15% is the infected on biomedical waste. That is the reason why if we mix everything together, then everything gets infected. Chance of infection multiplies. Aisha, yeah, it should be separately done.
Yes, yes. So 85% is, sir, general waste and 15% is
Hospital, biomedical hazardous
hospital
waste.
biomedical hazardous waste. Yes, that is an important. Another is, sir, where we discard the cautery pencil, wire, and skin stapler, vacuum tinners, and lignocaine jelly in metal tube.
Yeah, metal. A few of things are sharps. Sharp should be kind of done it in the separately, and metal should be done separately.
Right, sir. Right, sir. So, sir, thank you from the National Patient Safety Secretariat, and thank you for enlightening the audience on the various topics. Avdesh, Avdesh ji,
जी सर, जी सर.
सर अपना जो नेक्स्ट वेबिनार है वो एक जो शेड्यूल बना हुआ है, क्या हम उसको डिस्प्ले कर सकते हैं जो
Yes sir,
आप
allow me a
आप
minute.
जी प्लीज.
Yes sir, sure.
Meanwhile, Avdesh ji is displaying it on the screen. I would like to say that Eco India has been supportive in the back end support, whatever is required for conducting these webinars. We conduct these fortnight webinars in National NCD program also, wherein all the different aspects of non-communicable diseases we discuss with all the medical officers across the country from sub-center to PHC, CHC, and district hospitals. So that is a kind of a capacity building in the NCD program. In the patient safety as well, we are doing this for the medical colleges across. This is also a fortnight webinar. So जो अपना अवधेश जी इसमें अपना जो टेबल है वो दिखा दीजिए एक बार. So for the
Yes sir.
information of the audience, this is a annual calendar. I think you will have to put the next page. Yeah. So this is the annual calendar which is there, and the next webinar we have is on 19th of February regarding safe obstetric practices, basically obs gynae component in patient safety. And for these webinar series, we have drawn experts from all the functional aims in the country. 20 of them are functional. So in on a periodic basis, we give a chance to each of the aims. So next is expert from the Raebareli aims. Okay. So Avdesh, we can sign off.
Yes sir, we can sign off.
Oh, Okay, okay. Thank you everyone.
Thank you, sir. Thank you, Sriram, sir.
Thank you. Thank you.